Good morning, everyone. It's a pleasure to connect with all of you, to see all these doctors from Trivandrum here. So after the Power Pack session by Dr. Mithun, so we are going to now talk about brands and how we build brands. So one of the key aspects which we saw in our previous presentation also, doctor had rightfully covered that, is the patient centricity. So brand is all about patient centricity as well. So when we talk about brands, one thing is it just a name or is it something more than that? That's what comes to our mind, right? So like Shakespeare said, a rose by any other name would smell as sweet. So it's more about the smell rather than the name. So what really makes a brand, and especially in healthcare, how important is a brand and how we can actually build a brand. So let's go a little deeper into that. So to begin with, I would start with a brief introduction on Agilus Diagnostics. Agilus is one of the largest diagnostic centers in the country. So we have about 400 labs, 400 plus labs, and we have the largest network of NABL accredited labs as well. We are present in 30 states and union territories, and we have 3 centers of excellence. We employ about 7,000 people, and we have a large and robust test menu of over 3,600 tests. And we have a very huge patient base across the country. Regarding our presence in Kerala, so we have DDRC Agilus. DDRC is one of the largest diagnostic centers in the state of Kerala. We are present from the northernmost part of Kerala to the southernmost tip of Kerala. So we have totally about 300 centers spread across Kerala, with 6 wellness centers, 3 NABL accredited labs, and total 40 years of experience and excellence in healthcare. Talking about the healthcare scenario in India, so we all know that we are today the most populous country in the world, and that brings with it its own challenges. I know as healthcare professionals, you all know about these challenges. So the twin epidemic of continuing emergence of infectious diseases and chronic degenerative diseases is there. Lack of education, gender inequality, and explosive growth of population is also an important factor. We still haven't fully understood the impact of various epidemics like HIV, tobacco-related diseases, and even the tuberculosis is still a big issue to be looked at. When we talk about health and sanitation, we talk about water, sanitary facilities. So that is also a huge burden of disease, which happens because of this environmental sanitation and safe drinking water related issues. And last but not least, we also have poor implementation of public healthcare programs across the country. So these challenges, we can classify them as 5 A's. So awareness about healthcare or the lack of it, access to healthcare or the lack of it, absence of human power crisis, like what Dr. Mithun was talking about. One of the key pillars of hospitals are people. So it's the doctors, nurses, the paramedical staff who are going to be very critical for anything to happen to improve the patient care in the hospital. So affordability or cost of healthcare. So that's also another important aspect, which Dr. Haridas also covered, where affordability is going to be very, very, very critical. And that is going to determine how this is going to progress. Accountability or the lack of it. So that's another very important factor. Even in the US, we now talk about not just managed healthcare, we talk about accountable healthcare. So look at what is the outcome for the patient rather than how many patients you treated or how long you treated the patient. It's more about the outcomes. So private healthcare is a very strong ally that we know for healthcare in India, because almost we now know that 70% of the healthcare needs are provided to by the healthcare system, which is in the private sector. The public health spend as such in India is pretty low. So we have about 1.28% of the GDP being spent on healthcare. And out of this, the dedicated to health is just 4.8% and remains equal to that of in poor countries. So the private healthcare sector has actually risen to this occasion, and we have seen great strides in the last 20-25 years, especially when it comes to how private healthcare has grown and how it has contributed to this. The strong response that has been demonstrated during the pandemic has also put the private healthcare to the fore. Whether it is the laboratories or whether it is the hospitals, how soon we adapted, how our manpower, how our resources, how we adapted to the requirements for the pandemic is something which can be a case study for all. The latest world-class technology at the lowest cost globally. So the private healthcare systems in India, especially we know in Kerala, we have some of the best healthcare systems in the country. Kerala ranks #1 in terms of healthcare facilities across the country. And when you see the kind of healthcare that we offer here and the cost of that healthcare and you compare it with the developed countries in the Western Europe or in the US, it's a fraction of a cost. It's 1/4 or 1/5 of the cost at which you get this treatment. And this has been brought about by the private healthcare system. Another important thing, like what Doctor talked about earlier, Dr. Haridas talked about, which is the patient centricity. So one of the key features of our private healthcare system is patient centricity. And readiness and willingness to participate in public-private partnerships. So the government also realized over the last 10 years, we are seeing more and more programs where government wants to collaborate with private systems to provide healthcare not only to the cities but also to rural areas and to remote districts. So public-private partnerships are on the rise, and the private players are engaging actively with the public systems to provide these services. So these are the key takeaways from the current trends which are shaping the future. One of the few things which we can say here is that there is a lot of automation which is happening today. The process efficiency is getting improved by automation. So we have both digitization as well as digitalization happening of healthcare. So harnessing the tech and data. So when we talk about data, we now have the patient-centric approach we talk about. Privacy of data is very important. So that is also becoming a very important aspect. And the lot of data that we have, how we are going to harness that. Even today, a lot of information that we have is based on Western parameters, whether it is a reference range for patients. So all this can be improved if we actually harness the kind of data that we have of all the patients. So impact of climate change on health is also a very important aspect which we need to look at, with more and more hospitals going into public listing, and we are seeing a lot of ESG and governance related things being looked at more keenly by the hospitals. So hospitals also have to look at what is their carbon footprint and how they are going to contribute to the environment. And what we are also seeing is that in the case of private healthcare and in the case of healthcare as a whole, the Asian countries, especially the countries in South Asia as well as Southeast Asia, are contributing more towards setting the standards in global healthcare. And another last but not least is the focus on preventive health. So what we are seeing today is the hospitals and the healthcare systems are also focusing on prevention and wellness as an important concept of healthcare. So coming to our topic in hand, which is the brands and how the healthcare brands have changed over a period of time. So earlier, it was just about setting up a hospital. There was a utility-based service, there was a need-based work which happened. But slowly it was understood that it's not possible to build unless you have a strong purpose. So high quality of care through state-of-art infrastructure and latest technology is what is the focus of brands today. And it's not just a case-based approach, it's more of a diagnosis-first approach. We are also seeing that more and more healthcare brands are going to be digitally enabled now rather than what they were earlier. Patient-centric approach and personalized care is going to be another important aspect of the new age brands. Value-based approach instead of volume-based approach, where we talk about outcomes. So a diabetic patient comes to you, and what is the value add that you're going to do to him through your course of treatment, rather than how many drugs you've given him, how many days he stays in a hospital. So that is not going to be the parameter. It's going to be more of what is the outcome. So insurance companies are also moving towards that kind of model where they will pay healthcare providers based on outcomes rather than just what kind of treatment they provided. And ethics and ESG related things like corporate governance, environment, societal care, all this is going to be very important factors for the new age brands. So the modern day healthcare marketplace is fiercely competitive. And that means that you need to identify what exactly do you stand for when it comes to building a brand. So we all know, we have seen brands in other fields, like you have brands in consumer, FMCG, you have a lot of other brands, you have brands in mobile phones. So where there is an identification with a brand. Does healthcare really need a brand? So is it really required that you need to have a brand? Some people say that doctors are a brand by themselves. Some people say that it is just a facility, the infrastructure that you create, that is a brand. So it's not all that. There's something more to it, which is the DNA of the particular hospital, and which is actually the thought process of the promoter, which actually brings in that kind of a overall brand presence. So the good brands are always memorable, they're captivating, relatable, likable, and consistent. What is going to differentiate from other brands is the brand purpose. So in our case, saving lives is a purpose. So are we going to stop with that? Saving lives is a purpose of any healthcare brand. If is that the only purpose, how we are going to diversify further from that? How do we differentiate ourselves from the competition? That's going to be very important. How do we actually build trust and loyalty? So building trust and loyalty is very important for healthcare players, because we want the patients to come back to us after treatment. We want them to go back and talk to their family members, talk to their friends about what happened to them in the hospital. So that's going to be very important. So how are we going to ensure that? How do we also enhance employee morale? So that is a good brand. An employee is going to work for a good brand. He's going to feel good about it. He knows that he's doing something for a purpose. There is a strong purpose behind what he's doing, and that drives the whole morale. How do you increase market share and how do you increase shareholder value? So that is going to be always an important factor for any brand. So creating and reinforcing an unforgettable brand identity is a very important aspect which we need to look at when you want to differentiate between yourself and the competition. So one of the key aspects here is you have to conduct research insights to understand for your brand positioning, where you stand, how does your brand perform on various parameters, what is the top of the mind recall of your brand by the patients. When you talk about hospital, say hospital in Trivandrum, which is the hospital that comes to the mind of people? So which is the first hospital that comes to the mind of people? So that those kind of research activities are important for you to actually establish what kind of brand you have. We have also seen how categories are defined by brands, right? So we know things like Xerox, brands like Surf, they have become, they actually define the categories by a brand name. So such things can happen in hospitals also. A hospital means so-and-so hospital. So that kind of brand can be built if we actually stick to the brand purpose and we are able to communicate it effectively. So it's about, like what we said, it's not just about a name, it's about how we are able to actually perform and live up to the commitment of what we say is a brand purpose. So that is going to be very important, and this has to be communicated across the system, whether it is your top doctor, the top consultant who's working for you, or whether it is the housekeeping person or the nurse or the paramedical staff. Everybody should know the vision and mission of the hospital, of the healthcare brand, and they should carry forward that legacy in whatever they do. And if that is being done, the patient understands what the brand stands for, and that's how it gets spread. So you have to craft your own brand story and humanize your brand through storytelling, because it's very important to do this. And it's very much possible in our industry because we deal with patients, so there are a lot of stories to talk about. Every patient interaction is a story. So every patient comes with a lot of anxiety. So like Dr. Haridas told, we need to handle the patient with a lot of empathy and care. So compassionate care is going to be very important when it comes to handling patients. And that is going to define how your brand is. When you talk about identity, you need to create an identity and you have to maintain that identity across all platforms, whether it's whether you're talking about a full-fledged 500-bed hospital, whether it's a 100-bed hospital, whether you talk about an outreach center, an OPD center, a laboratory. The look and feel of the brand should be same across all centers, whether it is in the form of uniforms, in the form of boards and signages, all have to be uniform. So, and most important, we have to find and define our target audience. So if we don't really understand the kind of people whom we are going to serve to, which section of the society which we want to target. So that is going to be very, very important. So patient centricity, I'll not take much on this because Dr. Haridas already covered it. So the outcomes of having a patient-centric culture is that you will have unwavering trust and loyalty to the brand, recommendations to the friends and family. Because patient centricity is only possible when organization culture and employees stand on delivering the brand promise every single day. So another important aspect is quality, which is going to be a very key factor in determining what your brand stands for. As we know, quality in healthcare is rested on all these pillars: safety, effectiveness, patient-centeredness, timeliness, efficiency, and equity. So all these aspects we need to look at. So I'll not go into details because we are running out of time. So innovation. Another important aspect is innovation. Innovation can help brands stay ahead of the curve. Adapting quickly to change. So we have seen how we adapted to change during COVID. So similarly, there are multiple events that happen, like the crisis that happened, which was talked about by Dr. Midun. So those kind of, how do we adapt to those situations and how does a brand react? So that is going to position your brand as a brand with a purpose and a brand that stands for quality. So innovation is also about delivering personalized care. So earlier we talked about generalized things. So how do we devise a personalized program for your patients? How do we deliver personalized care to all your stakeholders, including your patients and their relatives and overall population when you talk about preventive health? So how do you actually categorize? Like for example, if it's a 45-year-old male who's coming from this particular region, so what kind of preventive wellness program you will define for him, what kind of treatment protocol you define for him, all this gets personalized. So a strong healthcare brand today also needs a robust digital presence. This is going to be very, very important because as we all know, we are moving into a digital way of healthcare. We have also recently seen how Amazon is launching a full-fledged healthcare brand across US, where they are talking about Amazon clinics across the country. Everything is online. So we also need to adapt to this requirement of online healthcare and where we stand in terms of how we are going to do telemedicine. To some extent, we saw this happen during COVID. We saw patients adapting to it. But over a few months after COVID, post-COVID, we see that patients have come back to the normal, back to physical requirements of healthcare. But telemedicine is still an important aspect which we need to keep in mind because that's going to be grown in a much bigger way in future. So I think that's all from my side. Thank you very much. And it's a pleasure to connect with all of you today in this Sunday morning. Thank you.